If you've been following any of my recent posts, you'll see that I've been talking a lot about sleep apnea, sleep disordered breathing, and upper airway resistance syndrome. So I'm interested in this topic because I am interested in all things that will increase your lifespan, your health span. We all want to, grow old as functional and as healthy as we can, and sleep is a huge part of how successful we will be doing that. So when I see a patient who I suspect has sleep disordered breathing, the first thing that I start with is the nose. You have to be able to breathe through your nose well throughout the night in order to get as much oxygen as you can, oxygen saturation, and to avoid sleep fragmentation. So if you have a blocked nasal passage, you aren't breathing as well. You have to breathe through your mouth. Things dry out. You're more prone to colds and sickness, but gum disease, cavities, things like that. But it's also the first thing that we need to set right if we're going to, repair or improve your sleep breathing. So I'm going to talk about a couple of products. The first thing I ask my patients is, can they breathe through their nose? There's a thing called nasal cycling where, and you've probably noticed this, where one side you can breathe well and the other side maybe not so much. And then like an hour later, it'll reverse. Like the left side you can breathe well, the right side not so much. So that is a normal phenomenon. But can you breathe through your nose? Like if you taped your mouth shut, would you be able to do that for like 3 to 5 minutes without feeling like you are suffocating? So if you can, or if you suffer from allergies and you just kind of have a stuffy nose, maybe a cold's coming on, whatever, it is important to always have an open nasal passage before you go to bed. So one product that I like is this nasal wash. This comes pre-mixed, but it also comes with little packets of special saline to mix with either distilled water or tap water that's been boiled for 5 minutes. You can refill this bottle. This is nice. You just place the tip under one nostril, gently squeeze until water flows out the other nostril, and then you switch sides. So this is going to cleanse the nasal passages really well. Here's the box in case you need the information. I got this at the drugstore for about $14. Another product that I really like is Xylir. This product is super great. It has glycerin, it has xylitol, which is antibacterial and antifungal, and it also has glycerin, which will kind of moisturize your nose for the whole night. So if I feel like I'm getting a stuffy nose, I'll either use this nasal wash or I will use the Xylir. And I haven't had a sinus infection since I've started using these things, which is great. This is also about $15. And then something that's really interesting is Johnson's baby shampoo. Scientists right now are researching adding this to a nasal wash. You add about a half a teaspoon into your nasal wash if you're especially stuffy, but they're researching this right now as it relates to COVID to clean out the nasal passages and possibly prevent the virus from setting in. The other thing that is really inexpensive and great is a Neti Pot. So I got this at my local food co-op. You can get it online. You can get it like at Whole Foods or something. It comes also with a special salt. You can't use table salt. You need a specially formulated salt to wash your nose. So wash your nose every night. Make sure that you have a clear passage for breathing, and watch my next videos for more tips on how to get a better night's sleep.